guys, good evening. This is Malaking, and today's vlog I'm gonna show to you this. Do you recognize this? Anyone knows the use of this one? This is a portable what you call pulse oximeter. So if you have heard about how to measure the oxygen content of the body, this is the device in measuring the oxygen content of the body, or for us nurses and doctors we call it oxygen saturation or SpO2. Yeah, the oxygen content of the body is monitored by using this device. This is just a portable device, and this is a battery operated. If you want, you can use this one. You can buy one like this, and I will show. This is actually unboxing. So there are price ranges. It is best if you buy the amount of like 100 dirhams and up, but this one I just bought 15 dirhams, sale in the Lulu. I think you can also buy one like this. This is just I just bought this one just to show to you how or what are we using in the hospitals in measuring this oxygen content of the body. So I have heard Tita Mel Conde mentioned about this. So which means even you as the layman's people know something about this. To unbox this one, this is how the box looks like, and you will read it as pulse oximeter. So this is what we are using in the hospitals, and this is just very cheap. I bought this very cheap, 15 dirhams amount only, just to show. My purpose is only to show this one to you. And so there is a leaflet inside the box. There is a leaflet. You can read the guide of this one, and there's a tie for this one, so you can bring it. You can just hang it in your bag if you have bag. And since this is battery operated, I would suggest that you should change the battery each month, used or not used. So that is the advice of every battery operated device. If you want it to be at least if you want it to be really reliable, change the battery every month, whether used or unused. So this is, I think, the AAA battery, the small one. So I will try, or I wish, I just hope that this works. This will work now because it's very cheap. I don't need this because I already know my body. And I just bought this one just to show to you how this should work. So as I am saying, put the battery in opposite direction, one negative, one positive, and the other side the other way around. I just hope this will work because it's very cheap. I'm wondering why this is very cheap. So now it works. Just switch on, push this to switch on. So it is now working. So it's reading now finger out. So it doesn't detect any finger inside. So this is the way how to do it. Oh, just open this one. Just lift it up. Put your finger inside. So you can see a light and indicator inside here. There is a light indicator inside. That is the one that reads the pulse. So most parts of the body have most parts of the body have pulses. So even this tip of our fingers has pulse. So everywhere, almost everywhere, there are points of pulses. So you see, it is reading now. I don't know if you can so this light, just point your finger where the light is. So it is now reading. It is inverted actually. It has. I think I should put it in the other hand, other finger. You see, I want to put it in the middle of the sensor. There are two sensors inside. One that blinks the light indicator, red light indicator. This is where your palmar side of the finger that you will put on. And the nail side is in the here. So palmar finger in the indicator, light indicator. It is now reading. By the way, I forgot to mention before, if someone has nail polish, you can do it the other way around. If instead of doing like this, instead of inserting it like that, because the nail polish will impede the reading. So you can do it the other way around. So both have sensors actually, but this one on top reads better. So just invert it if there is a nail polish. And if not in use, you can remove the battery. Just remove the battery. This is very very cheap, 15 dirhams. I was very happy na nakakita ako ng mura kasi bili ko nito dati is 100 plus dirhams. So I don't know anong nangyari. Bakit naging 15 dirhams na lang to? You see, ngayon naisip ko lang, binibenta na ngayon ito, parang over the counter na lang siya. Nabili ko na lang siya sa sa isang supermarket. Siguro kasi may nag-advise siguro na magandang magtinda nito. Mabenta to ngayon kasi this is a guide. Ito yung magandang guide. Ito lang yung this is what we call a basic tool in the field of nursing. In the field of in the hospitals pala. Basic tool ito kasi dito kami nagre-rely. Hindi kami nakakahula. Dito lang namin nakikita yung reading ng katawan ng isang tao. So, nalalaman namin, as what I have mentioned, nalalaman namin kung nag-iinarte yung isang tao at yung taong totoong may sakit. Kaya hindi siya pwedeng magdrama kasi nakikita namin. So, as you can see here, I have 98% oxygen content in my body, and there is also a reading of the pulse rate of my body. So this is a very useful device, and I would advise that at least you have one like this in your household, especially if you have relative or family member who has asthma, who is asthmatic and who has if you have kids, this is very very useful for kids, or if you have geriatric people inside the body, inside the house. Geriatric means if you have old people in the house. So you don't know when someone has the attack of any kind of disease or any kind of problem, lung problem, or any respiratory problem, or any allergies. And allergy, why I say allergy, yes, for those people who has acute allergies or allergy attack, they can also, upper respiratory might also be compromised if they have acute allergy attack. How it happens? Kasi once the person has acute allergy attack, the the upper respiratory organ, which is here the upper airways, might swell right away, and which causes the blockage of air, causes something bad in someone who has acute allergy attack. So this device, at least if you have this device, I will, by the way, I will discuss it next time, how the acute allergy makes a person very very sick. So at least if you have this device, you have a guide, you have a baseline. Just bear in mind that the normal oxygen content of the body is from 94% to 100%. Beyond 95%, 96% still acceptable, but once you reach 95%, it should already alarm you or anyone inside the house that that person is starting to get, or starting to have a problem inside the body. So you should get alarm, and by that time you should go to the hospital, nearest hospital right away. And in for us nurses and doctors, that is already an impending sign of something, respiratory problem, like respiratory failure anytime. So don't let this oxygen content of the body drop below 94%. So especially now, we are on a COVID-19 pandemic or crisis. So there are a lot of people that experiences sudden respiratory depression until they reach respiratory failure. So don't wait until we'll have a respiratory failure, because by that time it might be too late. So, in short, hindi siya magandang hintayin na bumaba ng ganoon kababa. So, 94%, make sure 94% na lang yung pinakamababa. Actually, by 95%, tumakbo na agad dapat sa ospital. And by the way, how we recognize that someone needs intubation, or that is what you call in Tagalog, tinutubo na yung mga pasyente. Nilalagyan na ng tubo dito sa bunganga. How we recognize those people? Through this device, and confirmed with the blood test, which we call it venous blood gas. But anyway, it's a very very complicated term already that you don't have to know. At least this basic thing will help you guide on what you should do if someone is failing in the sense of failing the respiratory failure of that person, because it is very very agonizing for the someone who is experiencing that problem, and we don't want it to happen to us, to happen to our loved one. So one tip: once this reading reaches 90%, we nurses and doctors are already getting ready of intubation anytime. And kasi we cannot allow someone who will experience the failing of this reading once it reaches 90%. So we are already getting ready kasi in the long run, like in few hours time, respiratory failure might occur. Meaning, yung lungs ng isang tao pwedeng mag-collapse anytime pag pinabayaan natin. And there are a lot of things that will compensate if this reading drops down. So, I will again explain that to my next vlog. So, as of this time, this is my vlog. As a nurse, and I would advise that you would have at least one like this in your house just to have a baseline. So this reading only reads the pulse oximeter, the pulse of your pulse rate of your body, and the oxygen content of your body. So we call it oxygen saturation content. And you are in the best, you are at your best if you reach 100%, 99%, 98%, 97%. If you have like nose blockade, it's a very, very simple thing which can be remedied by simple medication. But once it reaches 96, 95%, 94%, with you having the cough, you don't know, you might have COVID. So, I advise that you have this one. This is very, very basic in the household to have like this. So, once again, this is Paralagan sharing you this very, very basic information of this pulse oximeter. So, I will get picture of this one to give you a clearer vision of this reading, whatever reading is this one here. So, just make sure to change the battery if every month, used or unused. AAA battery, 2 batteries. So, something that you can tie on with this device. Bili kayo nito kasi malaking tulong ito sa atin. Lalo ngayon na nasa COVID crisis tayo. Ako pag nakakakita ako ng ganito, obsessed ako pag ganito eh. May nabili na akong ganito dati sa binigay ko nandun sa family ko sa Davao kasi may pamangkin ko asthmatic, yung tatay ko that time is COPD, chronic obstructive pulmonary disease, kasi smoker siya. Expected yun, lahat ng smoker na tao magkakameron yan in time pag tumanda na sila. So yung lung expansion, lung expansion is not that very effective like us normal people for those who are smokers. And I will explain that one in the next vlogs. So abangan nyo po. This is Paralagan, your nurse vlogger and pharmacist vlogger. And from today, I will be sharing a lot more of my profession. So thank you so much if you are watching this video, and if you don't have subscribed to me yet, don't forget to subscribe and hit the notification bell so that you will get notified every time I have video uploads. And bye bye and peace out. See you next